Whether you're leading a business, shaping education, planning your next career move, or just starting out, you're part of a global conversation about how we learn, work, and grow. If you've enjoyed this episode, remember to subscribe so you never miss what's next. And for early access to new episodes, first invites to events, and a chance to connect with others driving real change, join the community at globalskillspodcast.com, because the future of skills belongs to all of us. Today, we're joined by Revda Sari, Talent Manager at Compilio Health and Associate Member of the CIPD. With a background in healthcare and corporate recruitment, Revda is passionate about connecting people with purpose. She leads end-to-end talent acquisition and development, driving a people-first, data-informed approach to building inclusive, high-performing teams. Her experience with Bromley Healthcare has shaped her expertise in recruitment, onboarding, and workforce planning. Blending HR strategy with creativity, her early marketing career offers a unique perspective on the evolving world of talent management. Let's dive into her journey. Revda, it is a real honour to have you on the Global Skills Podcast. You're very, very welcome.
Thank you so much for having me for this podcast, really. I'm just looking forward to it. I'm very excited to share my experiences.
I'd love to start off with how you ended up in recruitment. And it's something I ask many of the guests before we deep dive into healthcare from a talent perspective. How did you end up on this journey yourself?
So myself, actually, I just really love to connect with people and communicate with people. And then because I was working as a marketing and communications back in my country, and I thought it's a good transition to just to do the recruitment in the first place. And I really love to just to connect the right people with the right job. And it just makes me so happy when they're doing their jobs really nicely. And then, finding the suitable candidate is very much making me happy, and giving them the talk and giving them the experiences that I have and some advices for their, journey. It's just a bit of motivating me all the time. So that's why I end up with the recruitment, really.
And I hear that a lot. And I think it's something I can relate to too. I mean, nothing can match that feeling of being able to help someone uncover a career path for themselves and then connecting them with it. I used to love that on a Friday, getting the calls from people, and yeah, it was the best part of the job. Healthcare is an industry that is an interesting one from a recruitment perspective. Naturally, people, I think, in recruitment are drawn to the fast growth, the attractive industries, maybe like tech or fintech. What drew you to healthcare in particular?
Actually, I just really love to help people.
And the skills that you need to work in the healthcare industry, I mean, stereotype is you maybe go to nursing, medical college, you acquire the skills and you go through the traditional pathways. But there are way more careers within healthcare. How have you seen skills assessed or evaluated for the health industry? Has it just been through those traditional pathways from education, or are there other ways of assessing skills and sourcing talent?
Actually, I think the healthcare is a bit of it's a very unique, sector. Just because you have the diploma, it doesn't mean that you can work in the healthcare, because it needs a passionate heart and a good background to just to get in a patient personality as well. And as you said, it's not about the doctors and nurses. It's just the the other roles are all helping the doctors and nurses to do their jobs as well.
And do people see this as, I say people, let's categorize maybe into early talent and even mid-careers that are considering new career paths. But do early talent see the health industry naturally as, if I haven't gone and secured a medical degree or a nursing qualification, do people naturally see this as an interesting career pathway? Or do you feel like there's more work to be done by educators and government to inform young people about the other career pathways that are available in the health industry?
And there's a shortage as well. I think they need to encourage people to get these degrees. I think that the challenge is in the healthcare is not giving enough information to the people, what they are going to face when they got their job. I think those people need funding to get into the other roles as well. So this can be founded to those people who are interested. There are some people, they are not interested, but they don't know how rewarding that job is. So I think they need to work together to just make this awareness to the people for the job.
When you say maybe it's not necessarily government's role, when I was researching around, the vacancy rate, I was so surprised to see that NHS, the estimated open full-time roles are 121,000.
Mm-hmm.
And then within the social care system, it's again about 152,000. So
Yeah.
huge numbers. So what does this mean for the industry when there's such a shortage of talent?
NHS gives you a secure job for every month. You will know that you will get paid. However, this is not enough for some of them. So this gives you an idea actually how NHS is paying very low when you compare to the other private sector. NHS is not looking for a complicated experiences. However, so when you work out of London, your pay dramatically drops, and that makes people more picky when it comes to out of London, really. And of course, when you go out of London, the transportation is very limited when you compare it to London, really. And they don't want to work outside London. They prefer work in London rather than going to the other places. This is not the main reason, but it's like a 60% of what's going on with the pay. There's not much more thing you could do at the NHS. This is my opinion, really. And I think they need to just invest to their learning and development more to just make people develop to the other departments as well. I can give you a nurse, let's say we can hire a community nurse. However, if we just train her with the other things, she can do more for the community. But it's all about investing people, really. They need to just spend more money to the people so they can just go further and further at the NHS so they can train the others.
I was surprised when I looked at the statistics around the attrition level for healthcare. And if we look at specifically now the NHS, it's about 10%, which I would have thought it was higher. And then we could bring in early talent or new talent to fill the easier to fill roles.
Yeah. So I can't say the private sector is not really investing its people. So they want to retain people really in a digital world and as well as in their company as well, because they are valuable to us and we're investing them in. We don't want to lose them for the private sector because we need those people. And if we like to respect them, I think we need to pay a little bit more money and then we need to invest them for their trainings. Listen to them, of course, what they wanted to be in their 5 years of career journey.
And we're seeing more and more different leaders are sharing that within the organization, talent acquisition and development and learning is all coming together to
Mm-hmm.
really support people. Because if you're going to put a lot of time and energy and effort to recruit and onboard someone, you want to make sure, as you say, that they feel valued, they're upskilled, reskilled. So in the role that you are in at the moment, can you tell me a little bit about what it is that you do, and are you experiencing that as well, that merging of TA and TM?
Yes, actually, because we have to work together at the end. Just because if I'm hiring someone, because the talent acquisition has people can see we have only one goal to just recruit people, but our goal is to retain people as well. And if you like to retain someone, as I said, you should invest them. Know how you gonna invest them and how you gonna retain in the business. Because when you invest the people, you grow and the people will be growing with you as well and they will be benefiting to the company and it's just a win-win situation at the end. So I think talent acquisition needs to work with the HR and the learning and development to just make sure that when you hire someone, you will be building their career path within the company as well.
And
I think, yes, we need to merge our power and then put those people into the places and never let them by themselves and always support them where they are and let them grow.
have you seen a shift of recent times into the formation of a health skills taxonomy, or do you still feel like the industry is a way off from having that?
I think healthcare is a bit of away from that, really. Just because we still need to touch people, understand people, and understand their skills. This is really my opinion.
And I think what's really interesting is that a lot of people now, as AI comes into the health industry, people are either wanting to stay on top and upskill or reskill, or they're saying, actually, this role is no longer for me. Are you seeing people now starting to transfer their skills outside of healthcare or actually even moving into healthcare? Are you seeing a shift as a result of AI?
Actually, yes, because right now the diagnostic services are using all those AI. They need to use this, yes. And I think people are coming to the healthcare rather than going from the healthcare because there are more room to grow and develop in the healthcare. We are in the beginning of the journey, and I think AI needs to get into the healthcare more and more in the future. But I think we are in the beginning. So I think people will come to the healthcare rather than going to the other sectors because AI needed for everything, really.
And maybe this is the opportunity for, that health AI academy, people
Mhm.
that have tech skills that have never worked in healthcare.
Yes.
And I guess it goes back to this skills taxonomy. If we understood within the health industry, there's core skills, hard skills that you need to go to university and acquire. But it seems like, based on what you're saying, there's a lot of soft skills that are actually very important. And it's being able to understand what they are. That's really interesting. Okay. So the role that you're in at the moment, you obviously have firsthand experience of like the shift that's happening in terms of applications coming in, the quality of candidates, how they're being screened. What's your overall assessment of the shift of what's happened in the last 1 to 2 years?
So I think so right now the healthcare business is a bit like depending on the visas sometimes. The visa is a bit a struggle, not a struggle, but it's the main bit of what I'm doing. So you need to make sure that everyone has the right to work and etc. Because of these sponsorships and people wants to change jobs, very frequently.
And what does that mean? What's the ripple effect? Is that just meaning roles are open for longer, or what does that?
Yes, roles are open for longer, and the roles that I'm hiring right now is radiographers, cardiac radiographers, and the in non-clinical positions that need some healthcare experiences. So people who are like, let's say I'm looking for some kind of a role right now, like a regional operations manager. When you look at the regional operations manager, I can find many non-clinical positions. However, I need someone who has a radiographer background and as well as who has some experience with the managerial skills and some more. And that's why it's a bit hard to find for me, just because people are working in the hospitals as a MRI radiographer who wants to step up a little bit. Right now, I'm a bit struggling because some of them has a skilled worker visa. Some of them are not eligible and some of them are not in the right location. Though this is what I'm struggling at the moment with the jobs.
So if that's a struggle today, and as we've kind of indicated, that there's no answer, and I know this is a global skills podcast, but clearly
Yeah,
we're doubling down on the UK.
yeah.
I do think that this is not an isolated story, so it's good to kind of dig deep. But if we're aware that there are no, I guess, additional suppliers of talent coming from apprenticeship programs, academies, there's no advice to young people about the career pathways into healthcare that are beyond the traditional career paths. What does the future hold, do you think? Like, if you were to crystal ball this and sort of say, well, if this shortage continues
Mm-hmm.
and the visa situation continues,
Yes.
what is the future for healthcare?
I think the future is not really, from my side, it's not looking very bright just because we just cut out the visa now. They're not really coming to the UK with their families and people just starting to find, starting to look for other countries to go for. And I think for what we should do is just, as you said, we need to make some awareness of what we need, really exactly what we need. And we talk about our budgets as well. And we need to encourage the young people to just go to the universities and get their degrees. And I think we need to just help them to fund these university degrees as well. So we can encourage them to just to study in the field and go and work with the community and the patients, because we need people. And as much as we need people, we as a private sector, I need people who is eligible working and who has the right skills with my machines and etc. And the NHS needs stuff for their community and people. So I think we always need to encourage people and found them.
I didn't expect to uncover such a huge problem, to be frank. I knew, you read the headlines about healthcare shortages, but just while I'm talking, I have stats popping up on my screen that in the next 10 years, we're looking at nearly 900,000 roles that will need to be filled.
Yeah,
Over 30-40% of those with the NHS. And the World Health Organization estimate 10 to 11 million global health worker shortage
yeah.
by 2030. So in the next 5 years, and that just has such a ripple effect. So if skills-based planning and industry and education need to work closer together, what are the first couple of steps that you would recommend? You're obviously in industry, you're on the pulse with talent. You can nearly see the tsunami of like shortages coming. What if you were to be sitting in front of government or heads of education right now, what would be the top sort of one or two things you'd be saying as consideration to try and reverse this situation that we're in?
I think we need more digital infrastructure. Like we need to just assess our data systems, and we need to use the AI tools more to just because some job doesn't need many people to work on. So I think this will cut a little bit more human workforce rather than, we can use some AI help rather than using the, person as, and then I think what we should do is just make people to go their pathways, like as I said, like a HCA, if they wanted to be a nurse, then we can fund them to just to be the nurse, go for a pathway to the nurse, so we can just cover those nurse jobs with our own team. And I think for the future, I think we just founding the growth and keep it rising the demands.
Yeah, I think you're right. And what I would say is the opening of this podcast, you really got me when you hit on it 2 or 3 times that you love this industry because of the fact that it's just all about caring for people. And I think that really appeals to the next generations coming through more and more about impact and maybe getting that message across about healthcare is accessible to all. And
Hmm.
this is how rewarding it can be. When you park, maybe the pay's not the best and the hours can be long.
Yes.
Actually, from a day-to-day rewarding perspective, it can be untouchable. And I don't know if that message necessarily gets through, to
Yeah, I
potential.
think we have to work together to just to make sure that everyone has this, greatness and beautiful, this beautiful, sector, because everyone wanted to be in the field and we have this rewarding job. However, as you said, we need to balance our work and life, and then, paying a little bit more to the carers and workers to just to make sure they're happy with what they are doing as well. So this can be more accessible to all, really.
Well, of all the industries that are currently hiring and, focused on the skills gap, this is the industry that we're all going to need one day when we're
Mhm.
older.
Yeah,
And it's the industry that we should all really give the most investment and thought and support to. What would that be and why?
I think I can give the second question a bit, because I think for people who are, who are in the middle of their careers, so they can see right now the technology is very much changing. And I think my advice would be just keep up to date yourself for not everything, but keep up to date yourself with the ones you needed and what you want it to be, so you can, grow yourself.
So thank you so much for being a guest on the Global Skills Podcast. I think what I'm going to take away is the fact that actually the healthcare industry is far broader and there's many doors in for people. But on a serious note, I think a lot needs to be done around connecting the education and industry and all these pathways and investment in people. And as you said at the end there, it's time to automate more and get more efficient. I think this was a really thought-provoking conversation. Just thank you so much for being a guest.
Thank you so much.
This is a Global Skills Podcast, conversations that shape the future of work and learning. We're exploring how we close the skills gap and build a future where everyone has the chance to thrive. From education to business, connecting people, ideas, and opportunities that drive change. It's about collaboration, curiosity, and creating real impact today. Because every skill learned brings us one step closer to a more inclusive world. The Global Skills Podcast, where learning and opportunity come together.